Understanding contraception. If you are of an age when it's possible to get pregnant, and you are having or think you might start having sex, you may want to think about contraception, which is also known as family planning. You can get pregnant after you start getting your monthly period. The age when you stop being able to get pregnant is a little different for everyone, but it's usually around ages 45 to 49. Using contraception allows you to decide how many children you want to have, and if or when you want to have them. You may know that you want to have children, or have more children, but you might want to wait until your youngest child has stopped breastfeeding, or until you finish school, or until you have a better job, or any other reason. Or you may have decided that your family is the size you want it to be, and you're finished having children. Whatever your situation is, contraception gives you the power to make decisions about your body and your family size. Everyone is different, and everyone has different ideas about if or when they want to have children and how many children they want to have. Thinking about your own needs and priorities right now will help you decide if you want to use contraception, and if so, which one you want to try. Here are some questions you can ask yourself to help you decide if you want to use contraception. Do you want to get pregnant this year? If you got pregnant right now, how would you feel? Would it be financially manageable for you and your family to add a child to your household this year? Thinking about your health conditions and history, are you likely to be able to be pregnant and give birth without risks to your health? If you answered no to any of those questions, then you should talk to your doctor about contraception. Almost all types of contraception are reversible. This means that after you stop using the contraceptive, you can get pregnant again. There's only one type that is permanent. It is a surgery called tubal ligation. This is an option you can consider if you're certain that you do not ever want to get pregnant. With the other types of contraception, it may take a few months for you to be able to get pregnant again after stopping using the contraceptive. This amount of time varies depending on which contraceptive method you're using. Here are some questions to ask yourself to help you think about which type of contraception might be best for you. Will it be easy for you to remember to pick up prescriptions for contraceptives each month and do things like take a pill each day at the same time? Will it be easy for you to go to the doctor every 3 months to get an injection? Do you have heavy, painful periods? If so, there are methods that can help. Would it be a hardship for you and your family if you got pregnant? If so, you may want to choose a method that is most effective at preventing pregnancy. Is your partner supportive of you using contraception? Do you want a contraceptive that you could use without anyone else knowing? Are you concerned about preventing sexually transmitted infections? Have you tried using any contraceptives in the past? What did you like or dislike about them? Here are some questions you can ask your doctor. Is there anything about my health and medical history that would make certain contraceptives better or worse choices for me? Does the contraceptive cause side effects, like irregular periods or cramping? How long will the side effects last? If I decide I don't want to use contraception anymore, or that I want to try a different method, how easy will it be for me to make that change? How long will it take for me to be able to get pregnant after stopping the contraceptive? How much does each contraceptive method cost? If you have health insurance, there's a good chance that your contraception will be free. If you don't have health insurance, there are clinics that offer financial assistance to help pay for contraception. There is also a type of daily contraceptive pill that you can buy at the pharmacy without a prescription. There are only 2 contraceptive methods available that men can use. The first is condoms, which are the only method that also protects you from sexually transmitted infections, but which are not the most effective at preventing pregnancy. The second is vasectomy, which is a small surgery a man can have that will prevent him from getting anyone pregnant. Vasectomies can often be reversed with another small surgery, but in general, it's a good option for when you and your partner have decided you're finished having children. Remember that the choice to use or not use contraception and which type to use is yours alone. You have the power to make decisions about your body and about if or when you want to get pregnant.